Hello, welcome to another Volteface Industry news show with myself and Katya, talking to you about all the latest news around the UK and Europe in the world of medical cannabis.
Yeah, good to do another episode. We're very coordinated today, Paul, with our Coca-Colas and
it's our uniform. Yeah, the Volteface uniform is black.
Coca-Cola in hand and black t-shirt.
And a Coca-Cola, yeah. Although I've gone for the slightly riskier version. Thanks so much for tuning in and watching the show. I hope everyone's keeping well. We've got quite an interesting bunch of stuff that's taken place in the last couple of weeks that we're going to chat through.
Decent amount, all quite medical cannabis focused as well. Should we jump straight in?
Let's jump straight in, mate. Go for it.
Cool. So our first story for today is CB1 Medical and some of the communications issues they've had in the last few weeks. For those of you that don't know, there's MedBudWiki highlighted this a lot. I feel like they're the on the ground like correspondent to the UK.
Ralph lets people know. If he sees something, he lets the people know. I love it.
Yeah.
He gets word out.
Calls everyone out. I really I like it.
Out there fast.
So yeah, they've been charging for a £40 fee for patients that want to dispense from a different pharmacy. And yeah, I think it's not. It seems like it is legal, but obviously just
we're not lawyers. It's not legal advice, etc. Blah 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 blah.
All of that disclosure, but it is a little bit cheeky.
It's definitely cheeky because it obviously incentivizes the patient to go in a particular direction and not have what should be a free choice to just go to any pharmacy. I mean, you could say that if with a £40 charge, choice remains, but there's an incentivization there to not go.
Yeah, so which I think highlights some of the challenges for patients in the industry around vertically integrated supply chains and certain clinics being partnered with certain pharmacies, certain suppliers and producers. So yeah, definitely a concern for patients. I guess one thing to note is that I believe CB1 Medical had really low initial consultations or switch consultations for patients coming to them to capture as many patients as possible. So, I mean, obviously people need to make their money back somehow. So if they're reducing costs there, they're going to need to increase costs somewhere else to favor their suppliers. So I guess from that point of view, it's understandable isn't the right word, but it makes some sense. But
you can see the logic behind it. The main thing is they have dropped it now in response to people raising a concern around this and saying that doesn't feel very fair for patients. So credit where credit's due in terms of removing that. And they're not the only group that have introduced a charge for going, an admin charge for going to other places. There are other clinics that do that, just not as high as the £40 mark. So I guess it's good to see that change. It's good to see a response from advocates and patients resulting in change, which is positive. But it does highlight some of the challenges that the clinics are facing, doesn't it, in that medical supply chain
and
model.
Definitely a lot of communications considerations that I think need to be thought through before you make these announcements or before you put it in place.
You're not going to get away with it because MedBudWiki's on it, so you're not going to get away.
Nothing's going to slide under past Ralph.
You can't sneak in a cheeky charge. It's going to get flagged. And there are challenges with that from a comms perspective for companies when stuff just immediately
so definitely
goes
considerations and contingency planning that I think are needed.
We're interested in the vertical supply chains, aren't we, and the impact that they have, the commercial viability and sense that a vertical supply chain makes in the industry. It's very strong, but there are some issues and impacts that vertical supply chain can then have on patient experience and preference. And medical cannabis is just very fascinating, isn't it? Because we've talked about this loads over the past few years, but it's very different to how other drugs are prescribed. You can see how that incentivization is fairly unique to cannabis, and how in its infancy that people aren't quite aware yet. So from a patient perspective, we spoke to patients who've said, I literally went to see my doctor and they just were like, oh, you're going to take these two straight. I didn't realise there was anything else. I didn't really realise there was any other options. It was just managed through that supply chain.
Yeah. Yeah, and I think for many naive patients, they're fine with that. They don't really mind. They kind of just want to be told by the doctor what products they need to take. But for those more experienced patients that have, maybe come from the legacy market, that have a lot of knowledge about the plant and know which products work for them, it's going to be different.
And that's why the advocacy element is so important, and patient groups are so important. So people can go and learn and understand what the market actually looks like. Market is an unusual word to use because it suggests kind of like, commercial consumerism, adults recreational, but the medical cannabis market does exist, and choice is a factor, isn't it, in terms of the experience you get, particularly in terms of strain choice. But yeah, fair play for them for dropping the charge.
Yeah, definitely. And we'll mention this at the end, but we're doing a webinar next week on the patient experience, and vertical integration's definitely going to be one of the talking points. So do register if you're interested in hearing about
register for tickets. Yeah, I'll put a link under wherever you watch this.
Yeah, but yeah, next story. Another clinic has opened. Medicinal has launched, which is another clinic in the UK. I think from what I've checked, we're on 43 clinics now overall.
Just 43.
The growing number.
Just a casual 43 clinics.
And no one actually knows how many patients there are. It's like the legend of the UK medical cannabis.
Someone says something at a conference, and everyone's like, that must be the number.
Yeah, that's
because such and such said it on this day. You're like, okay, that's the
so no one actually knows how many patients, but I think it's around 35,000. I've seen that quoted in a couple of mainstream articles recently. So yeah, by that math, we're looking at less than 1,000 patients per clinic. Obviously, not every clinic is the same number of patients, but if you're just doing an average, it's like 800 patients a clinic.
Yeah.
So yeah, some interesting statistics there.
There's a lot in there. There's definitely value in, I guess, a model of the more clinics that open, technically, the more avenues to educate the public and bring patients in. So like, I guess from our perspective, the more the merrier in some respects. It's like, it's all people paid money to go and educate the public and bring more people into the sector. But I think we're definitely reaching a point where if you are entering the medical cannabis market and you're opening a clinic, you need to offer something different or new.
New and different.
Like
and I think
just more. We don't need more clinic. We don't need more of the same clinics.
Yeah.
We're not at that point.
Yeah, you want a different strategy, a different patient cohort you're going after, different sort of like marketing style and social media promotion. I think there definitely needs to be a new thing that you're bringing.
Definitely. And it's interesting looking at. We could probably talk about this for hours, which we're not going to do, don't we? I find it really interesting looking at the different clinics and their model and approach to engaging patients. People are taking slightly different approaches. Sapphire, aka Curaleaf, I was speaking to a journalist a couple of days ago. It was like 2 days ago. I was chatting to a BBC journalist, and I was talking about cannabis stories and stuff, and he was kind of scouting out and seeing what sort of stuff he could cover and pick up. And he said, I saw a advert on Channel 5 for a cannabis the other day, and it was that Curaleaf one that ended up on Sky that snuck in. So, and I was on an industry call yesterday, and someone was like, I saw an advert on Channel 5. So, like, it's interesting seeing the different approaches that clinics are taking to reach groups. You've got some of the, like, infinite money cheap clinics like Curaleaf who are like, yeah, let's just do video. You know what I mean? Like, we can run at a loss. Let's just pour money into adverts. We've got other clinics, going to like influencers and stuff like that. But I think the main thing we've talked about with clinics is you need a social media presence. You need an active social media presence out there speaking to people. You can't just sit back and expect people to just
and I think just not going after like traditional forms of marketing and advertising, because I think people are just consuming the news in different and more novel ways, and especially with something like cannabis, which is got a lot of stigma, a lot of restrictions on what you can and can't say, and just like the volatility of the mainstream media. You don't actually know what's going to be covered and how. I think social media is the prime way to engage groups.
I believe so. I mean, I guess I find that one of the most interesting areas of the work that we do is that like evolving, changing landscape. And we would, we've said it multiple times on the show, and we've kind of debated it and discussed it with people that the amount of money you put in to get one piece of coverage in the mainstream media, that versus viral marketing campaign in social media, like
for that amount of money, you could, put 50 TikTok videos up or something, and you equating the reach and just the amount of content.
A lot of it's paywalled anyway. Even when people get like, oh, we got this coverage in the Telegraph, it's like people are just like.
Yeah, it's just like a nice little image that you have on a Twitter. It's like, nice, we did well.
Yeah.
Yeah. Well, on that note, in terms of new clinics opening up, Find a Doctor's also launched, which is not a clinic, and definitely fits into that new and fresh, innovative approach around how we can normalize and mainstream cannabis prescribing. So yeah, we've done quite a bit of coverage on the Volteface platform on this already, but Script Assist have just launched Find a Doctor, a new feature a couple of weeks ago. And yeah, I think this is a great piece of technology just for normalizing how cannabis is prescribed and just offering something different to patients that don't want to join a clinic, patients that have health insurance and could get their consultations reimbursed. And yeah, I think it just offers a good alternative as to how you can have holistic treatment alongside your cannabis prescribing, and see a clinician that is prescribing you for prescribing you with medical cannabis, but also just giving you a full 1 hour consultation just on your condition in loads of detail.
That's massive. I always really liked Script Assist and the team behind it, particularly because it is trying to do something different rather than just like, let's just do another of this, let's do another of that. It's like, okay, how can we break out of that mold and engage the mainstream clinically with doctors and with patients? I've always liked that, and the tech's good. The interesting part of it as well is also interesting for clinics to explore as a model, having that technology and how that improves services, because we know from chatting to a lot of the clinics that there are attempts to, I guess, add technology into that patient offer, but sometimes it's not great. Like the application of it's not great. It takes a huge amount of effort
having
and energy
to use
and
your
resource.
browser, and it just being a bit clunky as to how you book an appointment or how you access your prescription or how you get like an FAQ answered. But yeah, we've seen the Find a Doctor app, the Script Assist app with Find a Doctor embedded in it, and it's just really nice and seamless.
It's really, good. Really live inventory and being able to just one click order a prescription is a very strong. That's a very strong offer when you go outside that and be like, what's the alternative? It's not great. So yeah, I think that's cool, and it shows how like there is an opportunity to innovate outside of that just traditional model. 43 clinics now. The next time we do this show, there's probably 44. It is endlessly ticking up, and I think it does reach a point where to open the market, you have to overcome some of the barriers and the stigma that we've talked about. You talked about in known unknowns. And the best way to do that is normalization. It's stepping outside. Yeah. And if you start to get consultation fees paid for through insurance, that changes a lot. Yeah, that changes a lot, particularly if your consultation is an actual consultation. So there was that. Was it on Twitter? I can't remember.
Twitter.
I guess this one I spoke to Arjun. There was someone who was posting being like, "Oh, is it normal to have a 5 to 10 minute video call with the doctor?" And people were like, "No, 10 minutes is a little bit on the short side." Like,
yeah, I mean that's like a GP appointment. Yeah, if you want to, you need antibiotics or something, and but for seeing a specialist clinician, many people wait months and months and months to see a specialist. You want to get your condition properly analyzed, discussed. Exactly. So nice to be able to just combine the two. You don't have to go see a specialist for your condition and a specialist to get your cannabis prescription. Just merging them into one is really useful.
Yes, great.
So yeah, great work. Really good innovation for the market.
Big time.
Another good piece of news is Ananda have signed a supply agreement with their pending patent of a CBD formulation to be trialed in a phase 2 double-blind RCT for the treatment of endometriosis pain. Big mouthful, a lot to break down.
There's a lot there. I'm glad you're reading these out.
That's great news because, I mean, one of the main things that just continues to be brought up is the lack of evidence, the lack of RCTs, the lack of like really good standardized research into cannabis. One of the reasons being it's just quite difficult to to conduct research on the cannabis plant as a whole, being full spectrum. So yeah, this is, I believe it's an isolate, but yeah, really good to see. I think it's going to be a pilot initially of 100 women to assess the feasibility of a larger national trial. And yeah, I think this is really important because I think a lot of companies don't go down this route. Obviously, doing RCTs and clinical trials and research is very, very costly, and you never actually really know if you're going to make your money back because, you don't know what the research is going to say. But I think it's really important that this stuff is being conducted. And yeah, just refreshing for a company to be taking an approach that's like this, our goal ultimately is for this to be available on the NHS to anyone. And yeah, and I think what's interesting as well is focusing on conditions like endometriosis where nothing else works. Like basically it's you're prescribed contraception or you have to have a hysterectomy. Like there's not much in between that. And, we've done a lot of research and work into this, and, these women are in agony and so much pain and they're just at like a whim's end of nothing working. So I think there's an interesting observation around just focusing on those conditions that have such an urgent unmet need rather than trying 100%. To compete with opioids or stimulants or other, more conventional forms of medicine.
I think that's such a great point, and the strongest lever that the cannabis sector could pull at the moment in the UK is instead of this, like, we could do a separate show just talking about this really, is this, we were just talking about before we started the show, there's this perception that the biggest barrier to cannabis expansion in the UK is awareness. If you just educate the public and make them aware, then everything else will fall into place. We'll have all these patients. And like, I don't know if it's, and when we did that show ages ago that looked like an after party, whereas me and you in the studio just being like,
with that really dim lights.
Like, what is this?
Is it
like
5 a.m.?
Vibe. Well, I know, we just booked a studio. We looked way too casual, but we kind of went through like, what are the 10 main barriers that the sector is facing? And we agreed that number one was awareness. And if you
went down like basically step by step, you got more and more specific, and awareness was the biggest.
It kind of funneled down to like, but awareness was the biggest. But I don't like.
I'm not sure if that's.
I'm not sure if it's true. I'm not sure if it's true anymore because we're what? How many years in? Like 6 years in, right? To a medical cannabis program, we have 35,000 patients, and that number is obviously increasing. We're not going backwards. We're going forwards. However, the idea that it's just a case of making, the average 50-year-old aware that cannabis could help with pain, and then they'll suddenly jump ship and start using cannabis. Particularly flower, like grinding and vaping flower. I'm not saying one isn't still the biggest barrier. It may well be. It may well be. But there's an interesting question.
I feel like there's a bit more going on.
Yeah, I think stigma is still this huge thing. So I think what is probably the biggest opportunity for the sector right now is finding those conditions where people have started to give up hope. So pain can be that. Like, you can be using opiates and you can be a point where like, do you know what? I'm so sick of the impact of these opiates. I'm so sick of my pain that I'm close to giving up. Yes, I will try cannabis.
Yeah.
And like pain obviously is the biggest prescribed condition for cannabis globally, right? Like most markets, pain's the number one condition that people use it for. But these conditions like endometriosis and there are others that we've been talking about and engaging charities on where people are just like, do you know what? Like, there's just nothing. It's just not working. Like, I'm getting frustrated. That's where I think cannabis can play a really interesting role, and it's not battling the stigma because the level of very depressingly, the level of desperation leads people to be like, oh, I'll grind and vape whatever. I don't care. Like anything else,
as long as it works,
gets through the day. Yeah. So endometriosis, as we know from the work we've done, is a big opportunity there, and there are a number of others, which is why. We've not got this in the notes. Hope I'm okay to say this.
Yeah.
Just start gritting this signal. But that's why with the APPG recently we've been so proactive in engaging all these condition charities and starting conversations and saying, we think it's time for you as a charity, as an organisation, to start engaging with medical cannabis.
Yeah, and at least having it as an option that you can guide patients towards if nothing else works.
Yeah, totally. But yeah, and Jeremy spoke at the last ABG. It was really interesting about the doing.
Yeah. So great work, and just good for more research and innovation into this space.
Definitely.
Got
Media
a
watch.
quick little mainstream media watch.
Keep an eye on this lot.
There's been a couple of mainstream. Well, I've picked kind of just the key ones, but a couple of mainstream pieces over the last few weeks. This was a couple of weeks ago, but there's a really good article in The Guardian on the current state of the medical cannabis industry. Really well written, really well researched. I feel like some of the pieces of mainstream media are still a bit like hypey, like, oh, the medical cannabis market's worth £5 billion. And it's like, really? Where's it all gone?
Okay, well done, PR team.
So, I think it was a very honest assessment of where we're at. Spoke to loads of great case studies. I know Hannah Deacon was mentioned and interviewed for the piece. And it was a long piece. Like, I remember reading it, and it took a good 30 minutes of my morning to read through. I thought that was great.
Great piece. Yeah, really good piece of journalism. Well researched.
And then, GROW have been doing a lot of work to raise awareness of the legality of medical cannabis. There was a great piece in the Scottish Sun, I believe, a few days ago. I thought that was awesome because it just highlighted how easy it is to get medical cannabis if you want it. I think the headline was something like, I get my weed posted through the door and it helps treat my pain and it's all legal. I feel like it's like a clickbaity title, but like in a good way, because that is like literally that's literally how it works.
Yeah. Clickbait is good if through clicking it you are enriched with interesting information. Clickbait is bad when you click it and you're like, oh great, just wasted 2 minutes of my life.
Yeah, and when it's factual and true.
Yeah, it was a really good piece. That was good work.
So any work like that is great to see in the media. There's also been a couple of pieces. I think this one was in the BBC a few days ago. But there's been a lot of like national coverage around ADHD medication shortages. So shortages of Ritalin. I don't think it's Adderall in the UK. I think it's just Ritalin. And the impact this is having on patients. And interestingly enough, there's been a move from the PR teams of a lot of the cannabis clinics talking about how cannabis could fill this gap. So some interesting creative framing from the clinics. I don't know how many patients are actually converting to cannabis or whether this is kind of like a...
PR teams probably don't know that either. I think it's like a lot of the cannabis PR.
It's like,
we could say something here.
And it could be true. Yeah. We won't know.
It might be. We could quote saying it's probably true. You're like, okay.
So I thought that was interesting. Creative framing around the fact, and it's true, like cannabis could fill that gap and a lot of could benefit from
the conversation.
But I'm not sure how evidence based it is. And I'm not sure the kind of cannabis resistant patient groups, how they would respond and kind of react to this, because like we spoke about earlier about endometriosis being this urgent unmet need condition, nothing works, patients are at a whim's end. Whereas ADHD,
it's very different conversation.
It's a very different conversation.
This is why, I think this is probably something we should pick up and talk about in depth, or start to explore a bit more, because I think that is the challenge with ADHD. And so, I mean, we won't go into the details, but it's clear that of the patient groups that we're engaging, that is the most challenging conversation. If you go over to that group and say, right, here you go, medical cannabis, the response is, why on earth would you come to talk to us about medical cannabis when this drug works? Do you know what I mean? It's kind of like, it's not the kind of, we've given up hope, like nothing works, like please help us, we've got these patients, like this is really challenging, we've got hundreds of people that are contacting us about medical cannabis. Instead it's, whoa, hang on, this is dangerous.
Yeah.
We've got these medications that do a very, very good job. They save people's lives.
Yeah.
Don't you come over and disrupt that.
And cannabis is seen as that kind of comorbidity with substance use. And patients do self-medicate, but that's bad self-medication.
And there's a problem, there is, we talk a lot about ADHD, there is an issue with ADHD and suicide rates, particularly amongst men. It's a very problematic illness that's a bit It's a sad illness, really. It's not very nice. It's not very nice. It's kind of been like glamorized a bit by TikTok and social media. Like, oh, ADHD. Well, everyone's got ADHD. You know, there's this whole kind of like almost like glamorization of it and stuff. But when you get down to like what is ADHD, it is a really sad disease, whatever, for someone to experience. And is disease the right word? Maybe I've worded that. I've said disease, illness, whatever.
I think that's fine.
It's a very, very difficult condition to have, and if someone's found a medication that works, the idea of taking that away and trying something else without a really strong evidence base
is quite stressful.
Can be stressful for a lot of people, particularly when there's high levels of suicide rates and there's a lot of problematic behaviour associated with it.
I would also say that I think that Ritalin and just amphetamines and stimulants for treatment of ADHD, don't think like. Obviously, I feel like we're very aware of it because we do a lot of like reading and research into drugs and overprescribing of drugs and licensed medicines. But I think across the board, there's like the public still haven't kind of woken up to a lot of the issues with Ritalin and amphetamines, whereas opioids, I feel like everyone kind of knows that, okay, opioids are not good. And
a lot of people watch Dope Sick.
Yeah, and what the Sappers did was awful.
Like, it's really bad.
And all of this. I feel like everyone's kind of woken up to that, and like the opioid crisis is
agree.
That can of worms has been opened, but I don't think the same can be said about Ritalin. And like,
not yet.
Yeah. As in like, I think, people on like one end of the spectrum are very, very aware, but there's still so much education publicly to do for people to be like, oh, maybe my 5-year-old kid shouldn't be prescribed speed every single day.
And maybe for people, I don't know, it is a rocky road though, because it reminds me a little bit of when I worked in drug treatment, and you would work with people who'd follow the 12-step model, and it worked for them. Yeah, it was like they were abstinent and it worked for them. What you wouldn't do is have a conversation with them and be like, well, the research on there just being a magic gene that makes you. But you wouldn't do that, because you'd be like, well, hang on, this person's fine. This person was in a really difficult situation, now they're okay. So there's kind of a similar parallels there, isn't there, with like that way of life or that medication might not be without issue. The amphetamines,
but it works for some people. But if it works for
someone from a 2 out of 10 to an 8 out of 10, leave it there. Whereas endometriosis, no one's going, oh, with my endometriosis medication, my life is 8 out of 10. They're going, this is a nightmare. Yeah, it's not working. So it's an interesting discussion, isn't it, the ADHD.
Yeah, one that I think we can pick up maybe in a longer form podcast.
Yeah, and again, one of the areas that we're exploring with the APPG, with some of our APPG work, is try to bring, because that was an interesting conversation for us recently. It was kind of like, oh right, okay.
Quite eye opening.
Yeah.
So we'll keep you guys updated on that. And and then there was a study, I'm not sure in what journal it was published. I saw it in a couple of news outlets around cannabis legalization not being tied to an increase in treatment and hospitalizations, all hell will break loose narrative that the Daily Mail go down, and all these kids are going to start using cannabis gummies and be admitted to hospital. Just another example of when you legalize cannabis, things things don't get bad, and the hell hell stays below. So not much to say on that. Just nice to see some good coverage around how legalization does in fact help protect vulnerable people.
It's a good piece of research to share. Not that discussions in the UK with regards to adult use are going particularly well or anywhere, and that again is probably another thing to talk about another time. But it is a good resource for people to use and have to help push back against some of those arguments. Yeah,
definitely. And that's all the stories we have for today. I guess just one final reminder, I mentioned at the beginning, we're doing a webinar on the patient journey and experience in the UK on Monday the 11th at 6 p.m. So we'll put the link in the description, but do register. It'll be a really good conversation. We've got representation from a cultivator, patient group, clinician, and we'll be chairing it.
It'll be great. Attend live. We'll also put it out on YouTube and stuff after, and you'll see clips from it. But live is good because you can take part and ask questions. So check it out.
But that's all for us. That's all from us today.
Great. Good job, mate. See you all next time. Thanks for watching.